Welcome to the Be Yourself, Be Heard podcast. My name is Faisal Shaikh. I'm consultant psychiatrist. This podcast explores neurodivergence through the eyes of professionals. So, welcome, Tracy Dennison, to the Be Yourself, Be Heard podcast. Tracy is a consultant nurse practitioner, and she is from Hull, from Beverley. So we'd like to know a bit about yourself, Tracy, and before we delve into the discussion, tell us a bit about the title, Consultant Nurse Practitioner, and what do you do, and about your work.
Okay, cool. Thank you ever so much for having me. Like I said, I'm Consultant Nurse Practitioner, which sounds like a little bit of a grand title, but it does have roots behind it, and we really need to understand that. Otherwise, people don't necessarily understand what that means, and it can get bandied around a little bit as the trendy title. Essentially, when we are talking about clinical practice, we are talking about pillars of medicine, which include clinical practice, education, research, strategic management, and quality. And if we're hitting all of those kind of things, that's when we're talking about sort of the more senior levels in doctoring and nursing, all of those kind of things. So I do have a clinical practice, as you quite rightly said, in Beverley in East Yorkshire, and I also have clinics that I work out of in York and Milton Keynes, and we specialise mainly on female hormonal health, including skin health, because all of our bodily systems are very interlinked. And I think that we've sort of moved away from that as we all specialised and super specialised, and now we're kind of bringing it all back and beginning to understand how all that network works together. I do some research with a couple of different universities. I am an educator. I'm always studying and learning myself, and I have my business, East Riding Aesthetics and Wellness, which is heavily involved in sort of strategic direction as well as clinical direction. And I do work collaboratively with a couple of other clinics as well. So far as that goes. So if you hit all of those boxes, that's sort of where the consultant nurse role title comes from.
That's great, fantastic. Thank you for the explanation, because sometimes you don't do justice to mentioning a title and not knowing what exactly that entails. But as you helpfully explained, Tracy, I think you do a number of different roles within that, role that you have. So you are a business owner, you're a clinician, you're a researcher, you're an educator. So we're honoured to have you. Thank you for coming, Tracy.
My pleasure.
Yeah. So our podcast, Be Yourself, Be Heard, focuses on exploring neurodivergence through professionals and through the eyes of professionals. And as you are an experienced professional in the area of female hormonal health, we'd like to get your views on neurodivergence, but in your work as a professional in that area. But before we get to that point, let's hear a little bit about yourself, about your personal self, Tracy. So who is Tracy? What are your origins? Tell us a bit about your upbringing and the values that shaped you growing up.
Okay. So I was born and brought up in Beverley, so it doesn't appear that I have moved very far. And my mum and dad still live in the house that I was brought up in, really. I left school actually at 15, purely because of how my birthday falls, and went and became an apprentice at British Aerospace in Brough in their offices. I didn't like school. I did okay at school. I had to work extremely hard just to be average. It was not the right learning environment for me. Lots of people that I was at school with that I am very friendly with now, but at the time it was quite cliquey, quite a difficult place for me to be. So I did not want to stay there. I tried at school so that I didn't have to go back and do resits as I was told I would have to do if I flunked. So did that, went and did my apprenticeship at British Aerospace, which was an amazing experience. I met some friends that I still am very friendly with, and one who is my PA in that environment. So some really long forged friendships there. Worked my time at British Aerospace, did quite well, but always really wanted to do nursing. at the time when I...
So that was there from the beginning that you wanted to be a nurse?
Yes, yeah, very early on. My auntie was a nurse, my cousin was a nurse. We've got lots of nurses in the family. And it was definitely something that was there that I thought that I might want to do. And so once I'd sort of worked for 4 years at British Aerospace, I got an opportunity to go to Huddersfield School of Nursing, as it was back then, to become a registered general nurse, which is... it's at that point in time, the registered general nurses were being phased out. It was a form of education where we had small groups. We did a week in school. We did then about a 3-month block on your specialist ward. You went back into school. You did a portfolio, an assignment, an exam. If you flunked it, you were out. And if you passed it, you had a week's holiday. And then you came back and did the next block. So very, very different to the nursing education that we have today. Did that in Huddersfield. Once I qualified as a nurse, I went and did a short stint in America, did their qualifications, went and did a short stint in America, and then slowly worked my way back to Beverley.
Okay. So you worked as a nurse in America? Or?
Yes, I did. Yeah. Yes. It was only a short-term contract, but again, it was an ambition of something that I really wanted to try and wanted to do. So I went and did that. Sure. And then
so experienced the profession from a different angle, if you like, from a different cultural standpoint.
And experienced what the healthcare system in America is very, very different to our NHS. So we had some interesting conversations there because in nursing culture in the UK, and certainly within even the small group that I was brought up in as a nurse, it was very much don't be afraid to challenge people, don't be afraid to question practice. Just because we've always done it doesn't mean that we should always carry on doing it. Look at your evidence, ask people the questions. And then I went to America, and there at that point in time, I'm sure it will have changed, but at that point in time, it was the doctor was on the pedestal and the nurse did what he or she was told. And that didn't really fit very well with the culture of nursing that I'd been brought up into. So I had some interesting conversations around barn door infections that they wouldn't prescribe for until we had swabs back and things like that.
Sure. But I think what is clear from what you're saying, Tracy, that added to your experience and your well-roundedness as a nurse as you grew into your role, I'm sure. And just backing up a little bit here, Tracy. So you mentioned you always wanted to be a nurse. I just want to go a bit deeper. So what was the thing that motivated you to? Was there an early experience in your life that drew you into that? Something that you might have seen on the news, or something might have happened in the family or in the neighborhood?
I think I've always had that sort of desire just to help people in one form or another. And I've seen throughout my life people struggle at certain points, and either thought I want to be able to help or I want to understand that. So that,
So you had that curiosity from the beginning.
I think, curiosity and a drive to really try and make a difference, do something that counted to me. Everything that everybody does counts, but it's got to mean something on a very personal level.
I think that is very, very noble, I'm sure. So I think in a way you've answered my next question. So what values have shaped you to become the person you are today?
So I think, if I'm absolutely honest, I think my values changed pretty much the day I left school, because, like I said to you, school wasn't the best environment for me to learn and flourish in. And when I left school, I pretty much decided that I was going to be me, and I wasn't going to try and conform and fit in and do all of the things that keep your head down, be neutral, be invisible. Not that I was ever particularly loud or anything, but I was just going to be more authentically me. So for me, those values came from being authentically who you are, not trying to, pretend to be something that you're not in order to fit in, which was a sort of a big thing at school, really. And the values that I carry with me now are very much around the authenticity, honesty, collaboration, and when it comes to anything, but particularly in the business clinical world that I'm in, it's about building each other up. There's a lot of ability to tear each other down and to be able to put other people down in order to supposedly make yourself look good. And that doesn't ever sit right with me. I think, we should always be there helping each other rise.
I couldn't agree more. That's very good. That's wise words there. Thank you for that, Tracy. So let's switch gears now and talk a bit about your experience with neurodivergence. And by neurodivergence, we sometimes ask jargon we need to unpack. We talk about those conditions that are underpinned by unique wiring in one's brain, namely ADHD, autism. But we just want to get your views on neurodivergence, especially in the adult population, because there's more recognition, awareness of these conditions. So from a professional standpoint or personal standpoint, what has been your experience with neurodivergence?
I see a lot of neurodiversity within my working environment. I'm sure you could probably diagnose me with a whole range of things. My youngest son got diagnosed with dyslexia 6 weeks before he did his GCSEs, quite severe dyslexia, dyscalculia, visual stress, 6 weeks before his GCSE exams. That was fun. So, and I think that there's a lot. It's a huge subject, isn't it? There's tons and tons to unpack. But I think everybody's contribution, whatever perspective we're coming from, is really, really valuable. And I think the ability to problem solve, to think laterally, lots of the things that come as part of what we perceive as a neurodiversity skill set, if you like, are absolutely vital to society, to the work, to everything. So I think we need to just be a little bit more appreciative that we all have our own special skills, whether or not that's got a diagnosis or a label attached to it. And we need to be able to appreciate that and work with that, but also understand what might cause other problems. And for example, in my female hormonal health clinics, I see a lot of ladies going through perimenopause and menopause. I ask every patient, regardless of what they come for, if they've got any known neurodiversities, because that may change their experience. And therefore it may well change my approach to how I treat them. So it's very important to recognise and know.
So your message is, very much, I'm just regurgitating what you've said, Tracy, along the lines of appreciating not just the limitations, but also the strengths, because that's the other bit that sometimes we overlook. And because in the traditional diagnostic sense or assessment sense, we're focusing on limitations. But the other point that you made is awareness. So in your practice, you do pay attention to the possibility of that and you ask about that. So, and thank you for sharing the personal experience. So you said your son has been diagnosed with dyslexia, and that's a neurodivergent condition as well. But just to reassure you, this is not a clinical session. So we're not assessing or diagnosing anyone. I think we're just raising awareness. And, if you like, promoting dialogue around the subject for the benefit of everyone. So what would be your views on embracing difference due to neurodivergence? That's a broad topic, but I think...
Huge topic, but I think it's absolutely essential. We can't cut out sectors of society just because we've got a round hole and we've maybe got a square peg. If we do that, then we're looking at gender issues, race issues, cultural issues, faith issues, everything, aren't we? So we just need to be an accepting community of the world and accept that we are all that bit different and we've all got something to bring to the party. And if there are certain things that are triggering or difficult for people, we also need to be empathetic, sympathetic and accommodating of those as well.
Absolutely. That's very, very true. Thank you for that, Tracy. So let's move on to the motivational part of the podcast so that the audience can, be motivated with something that you've gone through and lessons learned from that. So have you coped with a challenge or underwent a sacrifice that you maybe want to share or tell us a bit about, so we can, and any lessons learned from that, of course.
Yeah. I suppose the biggest, most recent one for me in the last, what year are we in now, 2026? So in 2022, I stepped away from my NHS work, which I'd done for years and years with amazing people in a really supportive teamwork environment. And so handing my notice into my... to the guy that we called the boss, one of the consultant anaesthetists, was probably one of the hardest things that I've had to do, because actually part of the joy of the job was working with the people. So it was a huge and scary decision, but I was at a crossroads then where I had my private clinical practice and I had my NHS work running alongside of each other, and I'd got to the point where I actually didn't feel I was giving 100% of my attention to either, and I'm not very good at doing things without 100% conviction in there. So it was sort of a bit of a crossroads of kind of, right, I need to make a decision here. Am I going all in on the private practice, or am I going all in with my NHS role and saying goodbye to that part? And weighing everything up, which took some time. It was a very tough decision. We decided that actually stepping away from the NHS, which after 30 odd years is a tough decision, was a really difficult thing to do, but probably the right thing to do. What happened quite soon after that was my youngest son then got an opportunity to do an apprenticeship down in Silverstone with a Formula 2 team, which was every schoolboy's dream come true. There's no way in the world that he could possibly have taken advantage of that opportunity had I still been in the NHS, because it required my husband and I, he was only 16, my husband and I to split our time between Silverstone and Yorkshire, and we were sort of ships in the night, but to support him.
Yes.
It brilliant that we could do it, but we could only do it because I'd made that decision, and yet it was a really tough decision. So it was quite a turning point. It was terrifying. I have horrific financial anxiety. So I had lots of safety nets in place to make sure that if this all goes sideways, I can do this, or I can do that, or I can do the other. But it was tough.
That's inspirational, though, because as you said, it was a tough decision. You've been in the NHS for so many years, and you're familiar with what you're doing, and you're in a senior position there. To make that departure, I think it speaks to you wanting to have focus, because you said you either wanted this or that. So I think, and then making the whole thing work, like taking action, if you like. So, and you did that. But and I take it, what's your son's name? Mackenzie. So was it after you gave your resignation to the NHS that Mackenzie's placement came up?
Yeah, so I left the NHS in November 22, and he must have started in 23. Yeah. So there was a few months gap. I didn't know when I was leaving the NHS that opportunity would come up for him. But I'm kind of a bit of a believer that things happen for a reason.
Yeah, exactly. That's exactly what I was going to say. Yeah. Things happen for a reason. And absolutely. Yeah. Sure. That's very good. And thank you for sharing that story, Tracy. So just building on that then, what has been a moment of pride for you? Can you share any kind of win, a big win or a small win for you?
A few big wins this weekend, actually. Okay. We did all right.
Looking forward to hearing these.
As you know, I'm sort of specialist in female hormonal health, registered with the British Menopause Society. I'm also registered with the British Society of Lifestyle Medicine as a certified lifestyle medic type of thing. Can't remember the exact title. So everything I do is very, very holistic and quite... It's not unique. There are other people out there doing similar things, but there's not that many of us. So this last week, a week ago today, actually, I was at a conference called Menopause in Practice, and they have their own awards. So we were really thrilled, actually a little bit embarrassed if I'm honest. I was Menopause Nurse of the Year last year and I retained the title this year. Our clinic got clinic in the north of England. We got second in the UK for clinics.
Fantastic.
And second education provider of the year behind a British college. So my practice is small. It's a small organisation.
That's an absolute testament to your hard work and commitment and focus. I think leaving the NHS, I'm sure it's a difficult decision for anyone who's worked in there for long. But I'm sure when you have achieved these awards and credentials, you must be looking back and thinking
it was the right decision. It was a tough decision, but for me it was the right decision. But like I say, I had to go then all in on that. And I was chatting with a friend briefly that I don't see that often the other day, and she'd said to me, oh well, you're not really nursing at the moment, are you? You've retired from the NHS. And I was like, my goodness, I do about 90 hours a week. I work so hard. I'm just not hospital nursing, but I'm very much nursing. Yeah. So
I think you touched on this topic a little earlier, authenticity, Tracy. So how close are you to your authentic self in your dealings with people around you, or especially in professional? And I think we don't want to make you uncomfortable here. Speak as much as you would like about your authentic self. But more importantly, tell us, what is your formula for living authentically? Maybe this is something the audience can...
So I would say with me, what you see is what you get. I'm a Yorkshire girl. We call a spade a shovel. We don't really do facades in this neck of the woods. So this is kind of it. Like I say, really, when I left school, I kind of shed that inauthenticity and decided that it was time to just be me. And I've kind of grown into that over the years. So very much, this is me. I care deeply. And I think that's part of why I am good at what I do, because I want to know the nuts and bolts of everything, which is why I've studied so broadly. But then I also do find that, particularly when I'm doing my female health consultations, I allow a long period of time for those, because people come to offload. And I'm sure you experience the same, but when people offload, then you tend to absorb that as well. And then you do need some gaps in there to be able to reset in order to bring your best to the next patient. If I was seeing 10 a day, I'd be a gibbering wreck by the end of it, and nobody would want to be patient number 8, 9 or 10.
Absolutely. I think that's a very, very important point that you raised, that as healthcare professionals, we have to pay attention to recalibrating ourselves, and the recalibration has to come through pacing our work or giving ourselves spaces where we can be our authentic self. So
I think so, and I think that is the privilege of working in private practice. You do not get that in the NHS. You are fighting fires from the moment you step through the door to probably well after you've left, because the fires are still burning in your head. So the joy of private practice is that you can self-pace and you can block time out.
So that's a very valuable suggestion that you're making about, in terms of the formula for authenticity, so creating space, reflection, and pacing one's work. So these are very, very helpful to retain one's authenticity as a way of recalibrating. Otherwise, we're then getting into putting on fronts and as a result, getting isolated, exhausted, burnt out.
Absolutely. I think boundaries are a huge part of that as well. And I've not cracked that one yet. I'm still not great at boundaries. But I think if I could get better at that, I would be better at being less tired.
Sure. Definitely. So now we get to that point where we ask a policy question.
Okay.
And this is getting to the end of the podcast, by the way, Tracy. So my daughter Nawal has autism, and she has heightened sensitivity to crying babies' noises. Which makes it a challenge for us to travel, as you can imagine. When you're on a plane, there are not many escape routes. So what policy proposal would you give or think about as a way of helping someone in Nawal's situation to make their travel that much
more
comfortable? And also not to restrict them from traveling, because if that was a barrier, how can you overcome it?
I think there's a huge education piece in there. and not for your daughter, for everybody else. If I can just draw a little analogy, a good few years ago, so I do a bit of running, and a good few years ago I did some training to become, the title sounds all wrong, but a blind run leader. So run leader for blind people. And as part of that training, we had to wear glasses that obscured our vision in different ways.
Oh, right,
and then had to be led round by the person. You know, we took it in turns to lead each other. It was one of the scariest experiences because you were literally putting 100% of your trust in that other person, and you couldn't see very much of what was going on around you. I think just to bring it back to your daughter, there's a huge education piece for people who don't experience the world like she does around creating policies in schools or in adult education or in the workplace that people need, that we can create environments that create a similar kind of sensation to what your daughter will be experiencing, so they can appreciate that fear.
How distressing that can be. Yeah.
Fear and distress. And then when people can understand it on a sensory level, then they are much better placed to think, actually, this is really hyperstimulating. Maybe we can just bring this down a little bit.
Yes. This is so powerful, I think, what you're saying. So it's very much focused on education. Education at the school level, college level, workplace level, and I think also recreating some of that experience that an autistic person may be going through. Because for anyone else, hearing a baby cry is maybe nothing, or maybe a bit of an annoyance. But for someone who has sensory sensitivity of that kind, maybe nails on a chalkboard.
The blackboard.
Yeah, exactly. So, but it's the example that you gave about wearing those blacked out glasses to recreate that blindness experience, I think is a very powerful example as well. Yeah. No, that's very good. No, thank you so much for that, Tracy. Thank you very much for joining us on the podcast. It's been a real pleasure listening to you and learning from you, and hope to see you at a future podcast.
Brilliant. Thank you so much.
Thank you.